Greetings. My name is Dr. Cynthia Omina. I'm currently serving as the head of clinical services at AR Hospital in Nairobi, Kenya. My project was on strategies to improve women's leadership preparation for early career global health professionals, and I'll speak on insights from women in the private health sector. Globally, when we look at the healthcare workforce, 67% of the workforce is actually comprised of women, making them central towards healthcare delivery. And these women provide healthcare services to approximately 5 billion people worldwide. Therefore, the financial value of the women's input into healthcare services is estimated at $3 trillion annually. In Kenya, 75% of their workforce is actually female. The study done in the year 2020 revealed that Kenya has a total of slightly over 189,000 healthcare workers, with 58% of them being nurses. Out of these nurses, then 70% of them are actually female. However, the problem actually begins when we do have these women rise up their career. Now, what happens is that they get to see very few women in senior positions. We have loss of diversity. And what we have been able to see globally, that only 35% of the leadership roles in the global health industry are actually held by women. In Fortune 500 healthcare companies, women represented 23% of board directors and 22% of executives. However, none of those was a female CEO. We've also been able to see women taking 3 to 5 years longer to become CEOs. And because of this, we've also been seeing a higher attrition rate and a slower career progression. Some of the reasons actually that causing this to happen are actually increased home responsibilities and parenthood responsibilities. So why does this matter? Women are central towards economic growth. Women are central towards social cohesion, ensuring that the organization is able to perform, reduction of poverty, and also last but not least, promoting health, education, protection, and well-being of boys and girls. We went ahead and interviewed 12 women who work in the private healthcare sector just to listen to what they feel about what these problems are and the solutions around them. And what reasons did they give? One, lack of inclusive institutional policies that are not supporting women as they advance their career, lack of networks and female role models who can be able to support the younger women as they grow, social, cultural, and gendered norms, which actually stereotype around women's occupational roles, societal expectations around motherhood, where the woman is expected to literally provide full services around motherhood, sexual harassment within the workplace for women who are trying to rise up their career, occupational segregation, and gender pay gaps, where you find women are actually paid less for the same kind of work being done by the men. Last but not least, the imposter syndrome. So how do we change the trajectory? Some of the strategies that were raised were institutional strategies, which are around policy review to ensure these boundaries around flexibility, to ensure there is flexible working environment, remote working, part-time work, just to be able to support these women better, mentorship and networking opportunities to be able to support the women even as they grow their career. And this mostly would be done by fellow women leaders, equitable opportunities in hiring, promotion, remuneration, just to ensure that the women are not left behind. Male allyship. Why is this important? Just because, you need to be able to get women, people who will be able to understand the challenges that they have within the workspace and advocate for them. Training and mental health support in instances where women require a bit of assistance, even as they face challenges, institutional culture that will be integrative of the women, and of course, last but not least, ensuring inclusive leadership. We also learned that these women need to develop individual skills, some of them being around work-life integration, networking, personal development, and of course, also networking skills. So what next? We shall go ahead and do an institutional policy review. The institutions where we went ahead and interviewed the women, we'll go ahead and propose this, starting with my workplace. We'll provide networking opportunities. We'll encourage them to have group mentorship opportunities, to have peer support programs, and of course, institute a feedback mechanism for the women, just to be able to see how well do these strategies work and what areas need improvement. What has this program meant for me as a person? I've learned to be an authentic leader. I'm more self-aware. I know myself. I know my weaknesses. I know my strengths. I know where to draw assistance from. I've also learned my values, and I know what it means when somebody lets me know to do something that is standing against my values, and I've learned how to say no, and that no is a complete answer. I've also learned how to leverage on allyship I've learned that I do not need to be perfect, that what I need to do is to look at how do I perform even with my imperfection. I have learned inclusive leadership. I've learned to delegate. I've learned to ensure to provide opportunities for younger women even as they scale up in their career. And I do hope that this program can actually be beneficial for other women as it was for me. Thank you for listening.